The scalenus anterior muscle is the only muscle that can press on the carotid artery. It can also press, or it does press, on the vagus nerve and the phrenic nerve when it's in spasm, and it pushes on the brachial plexus, so it can pinch the nerves that go down to the arm. So one of the most troubling problems is it pushes on the blood pressure receptor, which is in the carotid artery, just happens to be right directly under the scalenus anterior. So we need to get this thing to release in order to fix a migraine, because a migraine is a headache that is caused by restricted blood flow to the brain. The carotid artery is the only blood flow to the brain, and this is the only thing that can really pinch the carotid artery. So most migraines really kind of have to be this muscle in spasm. So let's release it. Slowly increasing my pressure. Not very much, I have to be really careful. Make sure you're on the muscle. That's the most important thing. Do not slip off the muscle and press on the nerves under it or the artery, because that would be bad. But if you're on the muscle and you're carefully holding it and holding that rotation all the way to the right, encourage them to look to the right and hold it, you'll feel it start to release. Feel like it wants to start letting go. Release your pressure slowly, very slowly, for maybe 1 to 2 minutes, and you'll feel the muscle start to soften, and all of a sudden the range of motion will just open up more. So it usually goes with the big breath. So pull that energy out, open that scalenus anterior muscle up, and when it releases, it'll feel great. And don't press on their ear. The problem I'm having right now with her is actually my hand is touching her earring and it's jamming into her ear. So when you're cradling the head, don't do what I'm doing here. You have to be really careful and not press on people's ears or their jewelry. So anyway, sorry about that. Let's go back to the scalenus anterior. Let me show you a little bit more. So I think you're getting the idea. This is a way to release a migraine. And also, the phrenic nerve controls breathing. So that can, if someone's having shorter breath kind of feeling, it actually can be the scalenus anterior pushed on the phrenic nerve. The vagus nerve will make you nauseous, and even worse, it goes to the heart and the stomach and so on. So the vagus nerve is very close to where my fingers are. So you don't want to slip off the muscle and push on the vagus nerve, but by releasing this, you'll release the vagus nerve. What that does sometimes is it gets the stomach to start moving, and the small intestine, you'll hear it gurgling when this muscle releases. That's because you're taking pressure off the vagus nerve, and this is actually the way to fix nausea. A lot of people have nausea because the scalenus anterior is in spasm, and it pushes on the vagus nerve, which causes nausea. So let's show you how to release the scalenus anterior on the other side. Let me just go ahead and stop talking for a minute and let you really focus on what I'm doing. If you're trying to do this, just be really careful and stay on the muscles, on the scalenus anterior. Just do the drawings maybe first. Really try to visualize that the scalenus anterior muscle, this one on the left, on her left side, for example, when it contracts, it would rotate her neck to the right, and her head goes with it. So turning her head that way, the way I'm turning it, actually stretches it because it's attached to the side of the vertebra, and we're stretching those wings of the vertebra down towards the actual massage table and away from the first rib, which is under her clavicle, right in the front of her body. So honestly, there are several muscles that can cause neck pain, and any one of them, if they're in spasm, will give someone pain. So if someone's complaining of neck pain, you have to really release every single one of them. The scalenus anterior really is the main one to release.